Aging isn't about slowing down, it's about stepping into your power. Welcome to Don't Let the Old Lady In, the podcast where we challenge outdated beliefs about getting older and embrace wellness, self-love, and confidence. Your host is Lori Gardner, a registered nurse and nationally board-certified health and wellness coach, and she is your guide on this journey to vibrant, mindful living. Each episode will explore topics that nourish your mind, body, and spirit, and how to navigate health issues in the healthcare system as you age, so you can live with energy, purpose, and joy. Let's get started. Here's your host, Lori Gardner. Okay, ladies, welcome back to Don't Let the Old Lady In. This is your host, Lori Gardner, RN on duty here with the hospital series that I've been doing for this is the fourth week. We talked about the importance of being a care partner. We talked about fall risk. We talked about hospital infections. And this week we're talking about a hidden risk of just lying in bed. This is a silent risk that a lot of people don't know about that happens and can happen after surgery, and how just resting in bed can be dangerous. So this is all about blood clots and what families need to watch for. So when someone's in the hospital, the focus is usually on surgery, treatment, and recovery, right? And we hear things like, just rest, take it easy, stay in bed. Oh no. And while rest is important, there's a hidden risk that comes with too much immobility. And that risk, like I said, is blood clots. And what makes this especially important is this: they can develop quietly, and they can become life-threatening very quickly. But the good news is there's a lot you can do to help prevent them. So let me share a scenario that happens more often than people realize. A patient has surgery, everything goes well. They're back in their hospital room recovering. They are tired, they're in some pain, and they're not moving so much. And everyone is thinking, oh, good, they're resting. But over the next day or two, they stay mostly in bed. Maybe they sit up a little, but they're not walking much. And then something changes. They start to feel pain in their leg. It gets a little hot and red and swollen. Or sometimes there are no warning signs at all, and suddenly they develop what they call a pulmonary embolism, a clot that travels to the lungs, and they get short of breath, and things can go south fast. And what was a routine recovery becomes a medical emergency, and families often say, no one told us this could happen. So today we're changing that. What is this blood clot? Let's break it down simply. A blood clot, often called a DVT or a deep vein thrombosis you might have heard, usually forms in the legs. Why does that form in the legs? Well, because blood flow slows down when we're not moving. And when the blood sits still, it has a higher chance of clotting. Now here's where it becomes dangerous. If part of that clot breaks off and travels to the lungs, it becomes a PE, or a pulmonary embolus. And that can affect breathing, oxygen levels, and can be really life-threatening. And why are hospital patients so much at risk? Hospitals actually create the perfect environment for clots to form. Let's walk through why. Well, number one, immobility. This is the biggest one. When patients are lying in bed and they're not walking and not moving their legs, blood flow slows down. Surgery is another risk. Surgery increases clot risk because the body is in a healing state. Blood becomes more prone to clotting. And medications, some medications can increase clotting risk. Another factor is age and health conditions. Risk of a clot increases with age and chronic illness and any history of clots. And dehydration, people sometimes don't think of that, but dehydration causes thicker blood, and that equals a higher risk of clots. So what are the warning signs? What might you need to look out for? So signs of a DVT in the leg, I mentioned before: swelling, especially just in one leg, pain or tenderness, warmth or redness. Signs of a pulmonary embolism: sudden shortness of breath, chest pain, rapid heart rate, and feeling anxious like something's wrong. These are urgent. Always speak up immediately. So what can you do? This is where you can make a huge difference, because you sitting at the bedside, remember, you're the care partner. You have a job to do. You encourage movement when safe. We talked about the risks of falls and so on and so forth. So you got to take that into consideration. But I will say this, movement is medicine. Even small movements help. Sitting up, dangling the legs at the end of the bed. A lot of times, just taking a short walk. Oftentimes after surgery, like after my big surgery, it was a 7-hour surgery. They had, wasn't helpful for sleeping, but they had they put basically inflatable, your legs in inflatable cushions that go in and out. So they're moving your legs statically, so you don't really have to do anything, because they know after that kind of a surgery, it's going to take you 24 hours to kind of get up and go. So they make sure they're moving the blood with these automatic compressing. I can't recall the name of them, but boy, do they work. Keep you awake, but they work. So you do have to get to the point where you have to say, is it safe for them to start moving, and how often should they be walking? So this is primary, to be out of that bed ASAP, soon as possible. I mean, I got up. I knew that people have asked me over the years, what do they think? I had a long recovery, but it was efficient. They said, what do you think the number one thing is? I said, getting up and moving. I did not want to get up and move. I mean, I made sure I was well pain managed. That's the other thing I would take into consideration. If you have good pain management in the hospital, then you make sure that's being done before you get up and walk, because even then you will potentially have some pain. But I knew the only way I was going to get out of that hospital and recover well was to get up and walk many times during the day. And for me, because it was a GI surgery, when I ate, I got up and walked because it needed the help of the gravity and motility to get everything going. So you can't even walk enough. Honestly, when I would go out and make my first walk, I went to the next hospital room. That's as far as I could go, but that was fine. Come back. Next day you go another, to the next hospital room. But that's how important it is to get up and walk as soon as possible, safely. If you need to ask a nurse to walk with you or an aide, I would absolutely do that the first few times. You can also ask about prevention tools. I mentioned the compression stockings. Well, I had compression devices on me that were inflating and deflating I think it was like every minute. I almost ripped them off because I couldn't sleep, but I knew they were doing the job. But you can also then get the typical compression stockings, which I actually wear when I fly long distance. I recommend people do that, because you will hear sometimes people get blood clots on the plane because you're stasis. You're not moving. And that's not an uncommon place to get a PE or a deep vein thrombosis. So think about that. Aside from just being in the hospital, like flying in a plane can be a precursor to it. So those devices I mentioned, the sequential compression devices. Okay, this is a better name for them. Leg pumping sleeves. Also, they, if appropriate, they put you on blood thinners. And so you can ask, as a care partner at the bedside, what kind of clot prevention is my loved one on? And should they be using compression devices, like right after surgery? If they don't have them on, I think most places have them on people. So you could ask that. And, ask about the leg compression sleeves, because they're really effective. And remember, sometimes people, they get put on and somebody turns them off because, like me at night, I wanted to rip them off because I couldn't sleep. Every time I fell asleep, you feel a shh. It makes a swooshing sound. So just make sure they're on, because I've seen people turn them off. Encourage hydration. That's huge. If allowed, obviously follow orders. If you're not allowed to drink for other reasons, be sure. But fluids really help keep blood flowing. Always speak up about symptoms. Always better to be safe than sorry. To say something immediately if anything changes in the slightest way. So here's some ideas for what kinds of questions you can ask to be an effective care partner sitting at the bedside regarding clots. Should they be walking yet? Are we doing everything we can to prevent blood clots? You could say, I noticed the leg looks a little swollen. Can we check it? One place in the calf looks a little warm and she started to complain. Check it out. And then another question you could ask is, should those compression sleeves be on? So here's again, I want to get into the emotional side because it really is tough. We're all very emotional. We're in the hospital, but we've got to put our logistical intellect hat on and be really an effective advocate. So here's something important. Families often think they need to rest. And yes, like I said, rest matters, but so does movement. So the reframe should look like this. Rest and move. Rest and move. Because too much stillness can be dangerous. So blood clots are one of those complications that you don't always see coming, but you often can prevent them. And it doesn't take anything complicated. It just takes awareness, asking questions, encouraging safe movement, paying attention to any changes, and sometimes that small moment of awareness can prevent a very serious outcome. And you have to also know your patient, know that loved one in the bed. Are they highly communicative? Do they tell you everything going on, or they tend to be quiet and don't want to complain? Because if they're the quiet type that don't want to complain, that's where you want to develop a really good rapport in a really good way so that they will share when anything might change. So I hope this is really helpful. Again, it's another snippet that hopefully, even if 1% of this sticks in your head and you happen to be in the hospital with a friend or a loved one, something's gonna click. And be sure to go to the carepartnerproject.com, and download. They have a checklist for what to check on preventing blood clots. Again, take your notebook with you, use your notes on your phone, use electronic, whatever, but keep track of everything that goes on in the hospital, as you are the most important person for your loved one to be able to liaise with the hospital staff and have a really good outcome. So if you found this helpful, sometimes this can be life-saving. So share it with all your friends. And until next time, don't let the old lady in. And that's a wrap on today's episode of Don't Let the Old Lady In. Remember, age is just a number. Your mindset, energy, and passion are what truly define you. If this episode spoke to you, don't keep it to yourself. Share it with a friend. Subscribe and leave a review so we can continue this journey together. You are strong, vibrant, and unstoppable. Until next time, keep living boldly, loving yourself fully, and most importantly, don't let the old lady in.